Before starting the root canal treatment, let's have a look at the armamentarium required for the root canal treatment. These are the materials which are required for the access cavity preparation. First, the local anesthesia is administered. Then, with the help of air rotor, round, safe end, and endo-access spur, an access cavity is prepared. Followed by which the working length is determined and the pulp is extirpated with the help of hand files. After that, the tooth is irrigated with the help of sodium hypochlorite, normal saline, and chlorhexidine with the help of 2 and 5 ml syringes. After determining the working length, the biomechanical preparation is started with the help of an endomotor and rotary instruments. These are the endo boxes and the endo gauge, which help in the biomechanical preparation and measuring the length of the files. After the biomechanical preparation, the canal is isolated with the help of the paper points, and then a proper master cone selection is done. After verifying the fit radiographically, we proceed to obturation, which is done with the help of sealer, which is mixed on a mixing pad with the help of a spatula. Then obturation is done. For obturation, we require a spirit lamp, matchbox, spreaders, and gattaparcha cone of various sizes. After obturation, post-endodontic restoration is done. Here, the post-endodontic restoration is done using composite, for which we require an etchant, bonding agent, and the composite. And the composite is cured with the help of a light curing gun.
Let's see the access opening of the maxillary lateral incisor. The internal anatomical structure of the maxillary lateral incisor dictates the shape and size of the access opening. First, the enamel is penetrated at the center of the lingual surface at an angle perpendicular to it with the help of 4-number round burr in high speed. After penetration of enamel, the burr is directed along the long axis of the tooth until the pulp chamber is reached. A drop of the burr into the chamber is felt if the chamber is large enough. The overhanging enamel and dentine of the palatal roof are removed, including the pulp horns, with the help of the round burr. This is done in an inside to outside motion following the internal motion of the anatomy of the pulp chamber. The shape of the access cavity for maxillary lateral incisor is triangular, with base of the triangle incisally and apex cervically. After completing the access opening, we'll shift to the biomechanical preparation. It involves 5 phases. The first phase involves maintaining an apical patency. This is done with the help of a 10 or a 8-number K file. It is maintaining the length of the canal from orifice to the apex and removing the debris and the necrotic or the vital pulp tissue. The second phase involves coronal enlargement of the canal. It is done with the help of a coronal enlargement, that is Essex hand pro taper. Phase 3 involves determining the working length. Working length is defined as the distance from the coronal reference point to the point where the canal preparation and obturation should end. Working length was confirmed radiologically. The working length determined here is 22 mm. Irrigation is done with the help of sodium hypochlorite. Following irrigation with sodium hypochlorite, the canal is flushed with the help of a normal saline. The canal is prepared till 20-number hand K file. After preparing till 10-number K file up to the working length, 15-number K file is inserted till the working length, followed by 20-number K file. The filing is done with the help of EDTA gel, and irrigation is done after use of every instrument. S1 file is inserted up to the working length in the canal. EDTA gel is used as a lubricant. After preparation with S1, the preparation is extended to S2, F1, F2 and F3 files. Between each instrument, irrigation with the help of sodium hypochlorite and normal saline is done. After each instrument, recapitulation is done with the help of 10-number K file. When the biomechanical preparation is completed, the master gattaparcha is inserted into the canal according to the working length. After radiological verification of the fit of the master cone is disinfected by immersing it into the solution of sodium hypochlorite for 1 minute. Canal is isolated and dried with the help of paper point. Sealer is mixed on a mixing pad and the sealer is coated on the master gutta percha cone. With the help of gutta percha point, the sealer is applied on the inside of the canal. After this, obturation is done with the help of lateral condensation method. The DT is then smeared off with the help of a hot instrument. Following obturation, the tooth is restored with the help of post-endodontic restorative material.